This lesson is about the dynamics of aging. What happens to us as we age? The objectives for this lesson include the following. Appraise what our bodies do as we age. To comprehend lifestyle changes that impact health and well-being. And to become an expert on aging, to guide yourself, your parents, and your grandparents as they face health challenges in the future. People are experiencing increased longevity, and women tend to live longer than men. Regarding chronic conditions, 80% of those over 65 have one or more, and 50% have two or more. An average 75-year-old has more than 3 chronic conditions. 24.4% of non-institutionalized people 65 and older are in fair to poor health. And 7.3% of non-institutionalized people that age need personal care for assistance. Some experience limited health care services because they live in rural settings, are homeless, have ethnic or cultural biases, or are homebound. Chronological age is not an accurate predictor of physical condition or behavior. Rather, physical changes due to aging are driven by the environment and lifestyle choices, for about 60% of it. This includes exercise, nutrition, and stress, and only 40% is genetics. So let me repeat that again. 60% of your physical changes as you age are related to your environment and lifestyle changes, and 40% are based on your genetics. There's a lot to know regarding the physiology and the effects of aging. The cells of the elderly, regardless of when they last underwent mitosis, look the same as young cells. Old cells do not withstand a variety of challenges quite so well as younger cells. So this leads to changes when aging. There are 10 major systems in the human body that change when we're aging. Our heart, blood vessels, and hematological changes occur. The immune system, lungs, kidney and bladder, musculoskeletal system, the GI tract, neurological system, hair, nails, and skin, the endocrine system, and the reproductive system. Each will be reviewed in detail. These are changes that occur in the heart. There's a deposit of the aging pigment, lipofuscin, and that accumulates. The valves of the heart thicken and become stiffer. Fatty and fibrosis tissues increase around the SA node, which may result in a slightly slower heart rate. And there's an increase in the size of the heart, especially the left ventricle. This is common. The heart wall thickens, so the amount of blood and the chamber can hold actually decreases, and the heart may fill more slowly to compensate. A doubling of the percentage of atrial contribution to the filling occurs. An aging heart may be slightly less able to tolerate increased workload. There are also changes in the blood vessels. Arteries thicken and stiffen. It's thought to be caused by collagen cross-linking, and smaller arteries may thicken and stiffen minimally, but their ability to dilate and constrict diminishes significantly. In the veins, age-related changes are minimal and do not impede normal functioning. However, the aorta becomes thicker, stiffer, and less flexible, making your blood pressure higher, resulting in left ventricle hypertrophy. And a higher blood pressure may accelerate large artery stiffness and perpetuate a vicious cycle. Baroreceptors, which stabilize the blood pressure during movement and activity, become less sensitive with aging and contribute to orthostatic hypotension, which is the dizziness you feel when you get up too fast. There are also changes in the hematological system. The cellularity of the bone marrow decreases moderately. The immune system also changes. The efficiency of the immune system declines with age, but this is variable among persons. Nonspecific defenses become less effective, and the ability of the body to make antibodies diminishes. Autoimmune disorders increase, but not everyone believes this is caused from aging. And the thymus gland, which produces hormones that activate T cells, atrophies, and peripheral T cells proliferate much less exuberantly in old age. Common infections are often severe with slower recovery and decreased chance of developing adequate immunity. Changes in the lung occur. The number of cilia and their level of activity is reduced. Glandular cells in the large airways are reduced, and there's a decreased number of nerve endings in the larynx. The cough reflex is blunted, decreasing cough effectiveness, and there's decreased secretion in the nose and lungs, and decreases the ability to neutralize viruses, so people simply get more, especially colds, which can lead to pneumonia. The number of functional alveoli decreases, and alveolar walls become thin. The alveoli enlarge, and they're less elastic. The decreased elasticity of the lungs may be due to collagen cross-linking, and the loss of elasticity accounts for senile hyperinflation. Unlike in smokers, there's little or no destruction of the alveoli. This all combines so there's less functional alveoli with slightly thickened capillaries and a decreased surface available for the oxygen-carbon dioxide exchange, and it lowers. So the oxygen supply to vital organs, especially in settings of acute respiratory illness, occurs. The respiratory muscles lose strength and endurance, and there's increased stiffness of the chest wall. The pulmonary vasculature becomes less elastic, and pulmonary arteries thicken and enlarge, and there's increased resistance to blood flow in the lungs and increased pulmonary artery pressure. Renal blood vessels become smaller and thicker, reducing renal blood flow in the kidneys. There's decreased renal blood flow from about 600 to 300 milliliters per minute by age 80. Kidney size also decreases by 20 to 30% by age 90, primarily in the cortex where the glomeruli are located. This results in decreased GFR, typically begins to decline at about age 40, but by age 75, the GFR may be about 50% less than a young adult. A decline in the number of renal tubular cells, an increase in tubular diverticula, and thickening of the tubular walls occurs, so it leads to decreased ability to concentrate the urine and clear drugs from the body. These are all very significant changes. There are also changes in the bladder. The muscular urethra, ureters, and bladder lose tone and elasticity, and the bladder retains urine. This causes incomplete emptying. There's also a decline in bladder capacity from about 500 to 600 milliliters to 250, so less urine can be stored in the bladder. This causes more frequent urination, and the warning period between the urge and the actual urination is shortened or lost as one ages. There are also changes in the musculoskeletal system. In the muscles, sarcopenia, which is a decreased muscle mass and contractile force, occurs due to diminished growth of hormone production. This can lead to increased fatigue and risk of falling, which may compromise activities of daily living. It affects all muscles. For example, the respiratory muscle, where you have decreased efficiency of breathing, and the GI tract, which can lead to constipation. Bones and tendons and ligaments also change. There's gradual loss of bone mass because of bone reabsorption and bone formation starting around age 30, and a decreased water content in the cartilage. The wear and tear theory regarding cartilage destruction and activity doesn't hold up for osteoarthritis, but it's frequently seen in sedentary adults. Decreased water in the cartilage of the intervertebral disc results in a decrease in compressibility and flexibility. This may be one reason for loss of height. There's also some decrease in water content of tendons and ligaments contributing to reduced mobility. There are numerous changes in the GI tract. The atrophy and decrease in the number of anterior taste buds occur for salty and sweet taste buds. Basal and maximal stomach acid production diminishes and the mucosa thins. There's a decline in the number of gastric cells, so you have decreased production of HCl with an acidic environment necessary for release of vitamin B12 from food sources. There's a decrease in the amount of pancreatic enzymes without appreciable change in fat or protein digestion. And diminished gastric and pancreatic enzymes result in a hindrance to absorb nutrients such as iron, calcium, and folic acid. Hepatic blood flow, size, and weight decrease with age. Overall function, however, is preserved, but may be less efficient in the settings when you have drug overload. And there's decreased tone in the stomach and intestines, resulting in slower peristalsis or constipation. There are also changes in the neurological system. There's neuronal loss in the brain throughout life. Chiefly the gray matter, not the white matter. Neurons have increased dendrite growth, which may at least partially compensate for neuronal loss in some areas of the brain, and there's slowed neuronal transmission. There's changes in the sleep cycle. It takes longer to fall asleep, and time spent sleeping is less than in younger years. There's awakenings throughout the night and an increase in the frequency of daytime naps. The sense of smell markedly decreases, and the lens of the eye loses fluid, becoming less flexible and more difficult to focus at near range, and often people have dry eyes. Hair also changes. In men, they lose hair about the temples during their 20s, and the hairline recedes or baldness may occur. And they have increased hair growth in their ears, nose, and eyebrows, and a loss of body hair. Women may experience a receding hairline and hair becomes thinner, but there's increased hair growth around the chin and the lips, but a loss of body hair. Nails also change when they become thicker and more difficult to cut, and they grow more slowly, and they may have a yellowish color. There's also changes in the skin. The number of epidermal cells decreases 10% per decade, and they divide more slowly, making the skin less able to repair itself quickly. Epidermal cells become thinner, making the skin look noticeably thinner. Changes in the epidermis allow more fluid to escape the skin. The ridges of the dermal-epidermal junction flatten out, making the skin more fragile and easier for skin to tear. This process also decreases the amount of nutrients available to the epidermis by decreasing the surface area in contact with the dermis. This leads to slower repair and turnover of cells. Changes cause the skin to wrinkle and sag. The dermal layer thins and less collagen is produced. And elastin fibers that provide elasticity wear out. There's also decreased function of sebaceous and sweat glands, which contribute to dry skin. And in the sub-Q, fat cells get smaller, which leads to more noticeable wrinkles and sagging. And a note about sun worshippers. Solar elastosis causes rough, leathery-looking skin with wrinkles, irregular pigmentation, plaques, broken blood vessels, and acidic keratosis. This is all due to repeated overdoses of sun exposure. In the endocrine system, it's complex and interrelated, and it's difficult to discern the exact effects of aging on specific glands. Most glands atrophy and decrease secretions, and your hormones change. There's glucose homeostasis, reproductive function, calcium metabolism, adrenal function, and thyroid function. There's also changes in the reproductive system. In women, reproductive capacity decreases, and there's ovarian failure until it stops completely. This is transition from perimenopause at 40 to menopause. There's thinning and graying of pubic hair and loss of sub-Q fat in external genitalia, giving them a shrunken appearance. The ovaries and uterus decrease in size and weight, and the skin is less elastic, and loss of glandular tissue gives breasts a sagging appearance. Hot flashes can cause sleep deprivation if they occur at night, where you get sweats, irritability, depression, headaches, myalgias, and sexual desire is variable. Symptoms typically are present for about 5 years. There's also atrophy of vaginal tissues due to low estrogen levels, where there's thinning and dryness, and aggulation of the labia majora and minora may occur. In men, the testosterone decreases and the testes become softer and smaller. Erections are less firm and often require direct stimulation to retain rigidity. Fewer viable sperm are produced and their motility decreases, but men continue to produce enough viable sperm to fertilize an ova into old age. There is less seminal fluid to be ejaculated, though, and they may not experience orgasms every time they have sex. The prostate gland enlarges and results in compression of the urethra, which may inhibit the flow of urine. In summary, there are 10 major body systems that change as we age. These body system changes are important to know to understand what healthy aging is within the context of normal changes within our body. Thank you, and I hope you learned something in this module.